course, at DIA Munich, we need to learn about places which are really interesting, which have low-income patients. And of course, you have in DIA, you have from PharmAcces Foundation in Nigeria. You've worked in Africa for a long time. What does the foundation provide there?
So PharmAcces Foundation is a Dutch NGO actually, and its basic objective is to facilitate access to quality healthcare services for the very low-income communities.
And you do that completely digital, right? The phone is the center of your universe.
Well, the phone is the center of our universe, but it is the enabler. Okay, so we have to start with supporting, first of all, either the government or private sector organizations to develop the benefit package, to price the benefit package, to develop marketing and advocacy material. Then when it comes to implementation, that's when the digital comes in. So we use the digital to reduce administrative costs, to improve the quality of care, as well as to get additional utilization data to make our work much
What is the percentage of people in Africa which have access? I mean, you're in Nigeria, and this whole thing started in Kenya, right? In Kenya, actually, it all started from AIDS prevention help. But nowadays, I mean, Kenya is the best developed. They have a payment system. You integrate on top of that payment system, and you have a healthcare wallet. So, how does that work? I have a healthcare wallet on even a feature phone, but also as a smartphone. And how can I get healthcare, and who's paying for it?
Okay, so it can work both ways. So you're saving for the healthcare, or somebody's paying on your behalf. Once you're enrolled, the money is in your phone. So when you go to access a healthcare service, which has been accredited by us, then you can actually make a payment for the service through your phone.
And it can be my own money, but it also can be money from the Dutch government, which is basically subsidizing you and giving you aid, or you have the Bill and Melinda Gates Foundation can pay for it.
Well, there's so many donors, which is the beauty of the platform. The platform is an aggregator. So I can pay for you because I like you, or your father can pay for you, or Gates Foundation can decide I want to pay for this cohort of people, or the government can decide to designate a budget for the low income. So the platform is an aggregator, but the most important thing is it puts the power and the money in the phone of the individual.
Yeah, the money cannot be spent on anything else than healthcare by accredited healthcare professional. So the platform is also deciding who can provide healthcare or not. They have to be accredited by you.
Exactly, and to be accredited, you have to have a quality improvement standard going or process going. You have treatment protocols. We make sure that you're providing the right quality of care. So we don't really want to send you to someone who we know can't treat you.
Yeah, but it sounds like a very elaborate process what the platform is doing. It's payment, identification, it provides testing of the healthcare professional is good. I mean, how many people work in your company?
Well, we're a lot of people. Altogether, we're over 200. But the beauty is that we work with local organizations. We know that to be able to extend this technology, we can't do it by ourselves. So we try to find credible partners, right, who we can work with to extend the technology. So, yeah.
So what's the penetration of how many people are using your platform every month, every year? And how big is it at the moment?
Okay, the interesting thing is that there's a dashboard that is even available if you're given access. So right now, the last I looked on the dashboard, there was 1.4 million people on the platform with over 400,000 encounters, that is 400,000 visits to the hospital, over 1,000 clinics connected. So, you know,
that's per year or per...
So now it's per year, but the numbers change daily. So it depends on, you know, say for example.
So 1.4 is wonderful as a start, but yesterday we saw at Ping An, they have 300 million people in China provided, also very low cost healthcare. So now your challenge is to go from 1.4 million to 14 million to 140 million, because there's a lot of people in Africa which don't have healthcare, right?
That's correct. In fact, there's a dashboard that I saw just yesterday. In Kenya, as of this month, 73,000 people have enrolled. So what we're seeing is an average of 100,000 a month. And we as PharmAcces, we're supporting countries and communities in private and public health insurance with a catchment of over 30 million. So that is why I'm estimating that over the next 2 years, we potentially could have about 10 million people on the platform.
Okay, great. Over the next 2 years, 10 million, and now we need to go to 100 million because this needs... Tell me about how this company started.
Well, the company was started by...
Foundation, I have to say, right?
It's true, it's a foundation. It was started by Professor Joep Lange, who was an HIV/AIDS scientist from Amsterdam. His objective was to provide HIV retroviral drugs in Africa. And he says if you can get a bottle of Coke there, you can get an HIV/AIDS drug in there. So that is how it started. So his passion was Africa.
He's very famous in Holland,
Yeah. His passion is in Africa. His passion was how can you then expand that HIV/AIDS treatment into an insurance package? So you're not just treating HIV/AIDS, but the whole person. And that's really how it started. So we migrated from being a vertical program provider, solution provider, to a comprehensive insurance provider.
Okay, good. And that's a wonderful background. It's nice that it has grown further. What do you want? What kind of partners are you looking for here at DIA?
At DIA, we're actually looking for partners who can invest to either make the platform
scale the platform, but you're a foundation. I mean, is there a return on investment?
Well, that is where the partnership comes in. So PharmAcces Foundation provides the numbers and the support, while CarePay is the technology partner. So the investment potentially could go into CarePay, which is for profit.
And that is the tech platform, which makes it possible, and you can invest in that, and if it scales, there's a feedback. Okay. It's also the platform which you've created, the way of working, can also be used somewhere else. Is that also your objective?
Well, it is our objective. In fact, even though we're focused in Africa now, we potentially could move to China, India, where you have, low adoption of health insurance. And what I'm saying also here at DIA is that those companies that have never thought about going into Africa can leverage on our technology, because always you have a platform with millions of people on it. You can think about maybe a life insurance product.
Okay, and also for, if people want to be motivated, I can say to you, I want to pay for 10,000 pregnant women to receive healthcare, and then you make sure that that only goes to 10,000 pregnant, and I can basically decide how much money I want to add to it with a very good guaranteed result that it really is not going to spend on something else.
Fantastic, and that's already happening. There is a drug company, a pharmaceutical company that is already doing that, paying the insurance for 20,000 pregnant women. So it's phenomenal. So it's very versatile. There's so much you can do with it, but with one objective is to facilitate access for those who cannot afford it.
Very good and very inspirational, and also there's a nice angle that you can invest in the tech platform and use it somewhere else. How's DIA been for you?
Oh, it's been phenomenal. This is my first time on DIA. I think that it's nice to see all these tech companies as well as insurers.
But have you found people who want to talk to you, who want to work with you?
Oh yes, since my presentation I've had at least 10, and I don't want to mention their names, but big insurance companies that are looking for how they can collaborate with us.
And now also the interesting thing is, I think that this way of working, of having this platform and making it very universal, how people can pay and consume it, is very useful for our redesign of our healthcare industry. So you can also, by investing in you get insight into how to deliver low-cost care to a very complex society. So thank you very much for coming to DIA, and nice talking to you.
Nice talking to you. I appreciate the time.